How you doing? My name is Tracy Gartrell. I'm doing a lower leg assessment on my man's Trevor. Alright, first I'm gonna ask him to put his legs together, his ankles together. I'm looking to see if his knees touch before his ankles. If his knees touch before his ankles, that means my patient is not kneed. He is not. Now I'm gonna ask him to lift up his shirt and I'm trying to see if his weight is evenly distributed, to see if one load is more on one side of the leg than the other. He looks fine. Alright, next I'm gonna ask him to stand on one leg. Alright, I am looking to see if he can keep his balance. The average person should be able to keep their balance for at least 5 minutes. He could do that. Now I'm gonna ask him to do a single leg squat. Alright, as you can see, he does have a lack of balance and his leg is internally rotating. That is compensating for the weakness of the ITB band. Alright, next I'm going to ask him to do a calf assessment. Alright, I'm going to ask him to put his toes 5 centimeters away from the wall. Now I'm going to ask him to try and touch his knee to the wall without lifting up his heel. If the kneecap cannot touch the wall, that means it's a lack of soleus length. If the heel comes up off the ground, that means his gastrocnemius length. It's a lack of gastrocnemius length. Now I'm going to ask him to lay on his back. Supine position, the supine assessment. Alright. First, we are going to do a bridge test. I'm going to ask him to put his legs flat on the table, hands by his side. I'm going to ask him to thrust his hips. One more time. I'm looking to see weakness of his glutes or hamstring. Any pain? Be straight. Now I'm going to test his ankle malleoli. I'm trying to see if his legs is the same length. I'm trying to see if his ASIS is evenly leveled from this look. Do you feel any pain from this? All right, then we straight. Next, I'm going to palpate his ASIS. I'm trying to see if it's leveled across my patient's body to see if there's any tenderness as well. Straight. Now I'm going to palpate his pubic bone. Any pain, tenderness, then we straight. Next, I'm going to do a 90-90 test. I'm going to ask him to put one leg flat on the table, one leg in 90 degrees. Now I'm going to ask him to lift your leg. All right, the average person should be able to lift their legs between 70 and 90 degrees of flexion. We're testing your hamstring length in this test. All right, that's fine. Next, we're going to do a quadrant test. Relax. And this, I'm looking for a click and a pop. A click and a pop would mean a labral tear, just pain, no pain. A pain would mean impingement. Next, we are going to do the Thomas test. I'm going to ask him to stand up. Well, since we're in a small room, he can sit down. Can you put your knee to your chest and just lay? All right, if your leg comes up, that means it's a positive test. Now, if the leg stays on the ground and slightly abducts, that, which I think he is doing low key, that means it's a tightness in the ITB band. Next, I'm going to palpate his abductors. I'm trying to feel for any tenderness to see if my patient has any pain either. You fine? Right here. Now I'm going to palpate his psoas. Any pain, tenderness. Pain or tenderness would mean that the body is not happy with the load that's being placed on it, but he is fine. Now I'm going to ask him to slide back a little bit. I'm going to do a knee exam. All right. I'm going to try and move his patella bone every direction. You should be able to move in each direction at least 2 centimeters. That's fine. I am going to see if he has the ability to hyperextend his knee. If my patient cannot hyperextend his knee, that means he has not had the ability to walk because you need it. All right. Next, I am going to do a valgus test. I am testing for your MCL to see if it's still attached. I hope, well, I'm doing that. I hope you can see it. Next, I will do the Lockman's test, testing for the ACL to see if it's attached. Any pain? And we straight. Next, I am going to do a McMurray's test. McMurray's test. Give me a second. McMurray's test is. I'm testing for your meniscus. All right. Can you slightly bend your knee? All right. I'm trying to see, do you feel any click or a pop in your knee? If you don't feel a click or a pop, that means his meniscus is still intact. Next, I will do a straight leg raise by myself. I'm trying to see if I can put his hip into flexion. If pain or numbness, any pain or numbness, that will indicate a positive test. Now we will do a side lying assessment. Okay, toward that way. Now first, I will palpate his greater trochanter for any tenderness, which would also mean his body is not happy with the lack of load, or not happy with the load that is placed on the body. Next, I will do a PGM test to test the strength of the glutes. I'm going to ask him to kind of stay in his stomach, knee slightly bent, raised. I'm trying to see if he can keep it right there. He can't keep it right there. That means if you can't hold it up, that means you have a weakness in your glutes. That's fine. All right. Now your Ober test. I am trying to test the length of your ITB. I'm trying to see if his knee can touch the table, which he can't. If it doesn't touch the table, that means your ITB is too tight. Now, that's it for a sideline assessment. I will ask him to stand, to lay on his stomach, prone. The first test I'm going to do is your Eli test. I'm trying to see if your heel can touch your butt. My bad. I'm trying to see if your quads are too tight, real quick. Anything fine, but can't touch it. He cannot touch his butt. So his quads are too tight. Next, I'm going to do a passive leg raise. I am going to put 2 fingers on his glutes and 2 fingers on his hamstring. Can you raise it? I'm trying to see which one fires first. See if it see if his hamstring raises before his glutes. It would be abnormal if his glutes raise before his hamstring. That is it for my assessment. Thank you.